Good afternoon and welcome to another webinar. My name is Dr. Ken Stewart, and thank you for taking the time to connect with us on this new webinar that we're about to jump into. But before we get started, I want to just let you know about our YouTube channel, Epic Health Education. You could check us out there. We have over 80 webinars. They're free webinars that you can check out. Also, if you are inclined to receiving the most up-to-date webinars on our YouTube channel, you can just subscribe, and then every time I upload a new video, you can be notified quickly in regards to that. So let's get started. The topic for today is leaving the toilet seat down. Leaving the toilet seat down. I know when you probably read the title, you were thinking, well, what is this going to be about? So, as you probably know, more than likely is going to be due to have some connection with COVID-19. So before we get started, I want to just jump to our cheat sheet. You may have seen this or heard about this. So I want to just highlight some key points, sort of like a cheat sheet to kind of let you know how you can stay safe and how you can be careful to not get infected. And here are some of the recommendations. Stay home as much as you can. If you're working outside the home, so that's different. But if you can, stay home and quarantine yourself if at all possible. However, if you do go out, keep a safe distance, 6 feet from the other person. I know if you're in stores, it's a little different, but do what you can to maintain that 6 feet. Wear your mask. As you probably know, right now, it's in terms of date, it's July 9th. Right now, we're having a, a rise in new cases. I believe today in California, we had a high of 9,500 in California. So that's a big number. That's why I would recommend, or it is recommended, that you wear your mask outside. If you're at work, wear your mask at work. Wash your hands often. If you can do that, that would be that will greatly reduce your risk. Wash your hands often. Make sure you have cream, because the more you wash your hands, the more your hands doesn't feel well as much. It gets a little hard or feel hard. It doesn't feel as soft as before. So moisturize your hands after you finish washing them. No face touching. I know that may be hard to do for some people. And then if you're sick, call ahead. If you're sick, don't go to work. Call your boss. If you're sick, you can also see your provider via online telehealth. So these are some cheat sheet recommendations that you can incorporate into your daily routine. All right, let's jump into our presentation for this morning or for this afternoon. Scientists simulated toilet water and air flows say in a new research paper that aerosol droplets forced upward by a flush appear to spread wide enough and linger enough to be inhaled. So, for the most part, we're dealing with all of these issues, concerns, work, school, kids' school. Add this to your list of worries in these anxious times. Coronavirus containing clouds that waft into the air when the toilet is flush, or toilet plume. The novel coronavirus has been found in the feces of COVID-19 patients, but it remains unknown whether such clouds could contain enough virus to infect a person. The authors say the possibility of that mode of transmission calls for action in the midst of a pandemic. And that action is closing the lid or leaving the toilet seat down. Another study published in March 2020 in the Journal of Gastroenterology found significant amounts of coronavirus in the stool of patients and determined that viral RNA lasted in feces even after the virus cleared from the patient's respiratory tracts. That's a big concern. Big concern. So you have the virus lasting for a longer time in the feces, but also even after it has left the patient's respiratory tracts. So that's another reason why we need to be concerned about this coronavirus as it relates to toilet, as it relates to flushing, as it relates to the toilet plume. So you may be asking, what about toilet seats? Is that a concern? Well, seats shouldn't be a major concern. And the reason being is that research has found that public and household toilet seats are typically the cleanest surface in restrooms. That's probably because so many people already wipe them off before using them. So rest assured, seat covers aren't a high risk. Now let's jump into pet safety. No matter how many water dishes we leave around for our pets, some cats and dogs will still opt to drink from the toilet bowl. This isn't just a mess, but can also harm your furry friend. Even if the toilet water is clean, chances are the bowl isn't, and your pet is now lapping up harmful bacteria. Putting the seat down is an easy action that can prevent this. Child safety. Obviously, if you don't want your pet drinking from the toilet, your child shouldn't be either. However, even if your toddler is smart enough to stay away from the toilet bowl water, an unclosed toilet can pose a threat to your kids. There have been several cases of children falling into toilets and harming themselves. This is why you can even buy child locks for your toilet. These are all helping to reduce the risk of this coronavirus. So please be aware of that. Your toilet seat is not a recliner. There is a lid on the toilet for a reason. Like many other lids, it's there to close it after it has been used. I'm sorry, like any other lid, it's there to close it after it has been used. When you open the cookie jar to get a cookie, you put the lid back on after. So do the same and close the lid after using the restroom. So to end, here are some recommendations. Before you use the bathroom, you wipe. After you finish using the bathroom, you flush and leave the area, the stall. Your third step is to wash your hands. The last step is you hand sanitize or use hand sanitizer to clean your hands. And then if you want to add a fifth step, you can put on a moisturizer, hand moisturizer. So wipe before, flush and leave, wash hands, hand sanitizer, cream. All right, this brings us to the end of our webinar or free seminar, Leaving the Toilet Seat Down. Thank you for taking the time, and I look forward to connecting with you next week.